Lotus birth is the practice of leaving the umbilical cord uncut after childbirth so that the baby is left attached to the placenta for about 3 to 10 days or even longer until the cord naturally separates the umbilicus. In the full lotus birth practice, the umbilical cord which attaches the baby to the placenta is not clamped nor cut at all. Lotus birth is also medically known as umbilical cord non-severance or UCNS in short. Despite being practiced in some places around the world, notably with home deliveries, data on lotus birth are lacking. So, why is lotus birth becoming more and more requested and practiced against well-established medical recommendations? The following reasons are mentioned by providers and parents practicing or demanding a lotus birth. Number 1, they believe lotus birth offers less stress to the baby in comparison with the medically recommended cord clamping and cutting. Number 2, they state that lotus birth facilitates induction of immunity as well as bonding with the mother. Number 3, some spiritual reasons are also mentioned and revealed. For instance, it's believed that a lotus birth is more gentle or a less invasive transition to the baby into the world. Number 4, a lotus birth is defined by some as a smooth spiritual transition which honors the relationship between the baby and the placenta. In fact, in a community in South Africa, the meaning given to the lotus birth is that families value the transition between the intrauterine life and the extrauterine life of the newborn. They value the connection that the baby has with the placenta as the baby spends 9 full months with it, receiving nutrients and oxygen from the mother through this placenta. Therefore, the placenta is considered as a virtual twin to the baby and not an anatomical waste to be brutally cut and discarded from the baby once the baby has the possibility to live on their own after birth. Therefore, the placenta is considered as a virtual twin to the baby and not an anatomical waste to be brutally cut and discarded from the baby once the baby has the possibility to live on their own after birth. These are just community and traditional considerations and beliefs. So, is there any medical or health benefit of lotus birth? Currently, there is no scientific evidence to back any lotus birth health benefit. But lotus birth providers and parents practicing or requesting lotus birth state that: Number 1, lotus birth may increase blood and nourishment from the placenta to the baby. Number 2, having a lotus birth may prevent the baby from being moved and passed around a lot during the early days after birth. And this could encourage mother and baby bonding and help to establish breastfeeding by limiting mother and baby separation time. So, what are possible risks and challenges surrounding lotus birth? There are limited research on lotus birth, but the few research done on lotus birth have established the following risk. Number 1, risk of infections. Having a decomposing placenta attached to the baby for days or weeks during the practice of lotus birth have facilitated dangerous pathogens moving from the decomposing placenta to the neonate. In December 2018, the Royal College of Obstetricians and Gynecologists have warned about the risk of infection as the decomposing placenta tissue becomes a nest for infectious bacteria such as Staphylococcus. In fact, if left for a period of time after the birth, there is a risk of infection in the placenta which can then spread to the baby. Blood clots in the placenta serving as a significant media to pathogens. And at the post-delivery stage, the placenta has no active circulation of blood and it is essentially a dead tissue. Leaving such a dead tissue attached to the baby for days, even weeks, is obviously not a brilliant idea. In one such case, a one-day-old baby whose parent chose lotus birth or UCNS was brought to the hospital in an agonal state and was diagnosed with a severe sepsis and required an antibiotic treatment for 6 weeks. And in 2017 in Australia, a baby died hours after birth from sepsis in the setting of lotus birth, which took place at the Royal Children's Hospital in Melbourne. Investigation identified lotus birth as the most significant and severe risk factor for sepsis. Cases of the umbilical cord getting accidentally ripped away from the baby have also been reported. These have led in some cases to massive bleeding from the newborn. In addition, during lotus birth, the third stage of labor is managed passively and not actively as medically recommended by current guidelines. The controlled contraction is not well done in order to keep the placenta intact. Of course, the delayed cord clamping is not done. And no oxytocin drugs are given. The only action that may be done at that point is the uterine massage, and this only after the placenta has been expelled passively. Knowing advantages of the active management of the third stage of labor, this can be challenging for the healthcare providers and can lead to a massive postpartum hemorrhage, the leading cause of maternal death. And we recommend you to watch our videos on postpartum hemorrhage on this channel. Other risks include jaundice caused by abnormal high bilirubin levels and polycythemia. In history, lotus birth has been practiced in many regions of the world over centuries. But before the mid-1950s, the term early clamping was defined as umbilical cord clamping within 1 minute of birth, and late clamping was defined as umbilical cord clamping more than 5 minutes after birth. Currently, when the baby is born, recommendations are to wait 1 to 3 minutes before clamping and separating the umbilical cord from the placenta. However, lotus birth is the practice of leaving the umbilical cord and the placenta attached to the newborn until natural detachment from the umbilicus. Although recently, lotus birth has become a trending and alternative birth phenomenon in the West and in South America, the super delayed umbilical cord severance taking up to an hour are common in home deliveries. When asked, home birth attendant report to practice non-severance of the umbilical cord as a preventive measure, as they believe it protects infants from an open wound infection. In 1980s, the midwife Jean Parvati Baker was the main advocate for the practice in the United States. In lotus birth, the baby and the placenta are delivered normally, but the mother chooses to leave the cord untied and uncut so that the two remain attached until the cord falls off on its own. This is obviously in contrast with the conventional practice of carrying the umbilical cord to detach the baby from the placenta, which should occur according to current recommendations 1 to 3 minutes after the baby is born. The lotus birth practice was named after Claire Lotus, who observed that some primates did not separate their placenta from the newborn. So, what really happens to the placenta during the lotus birth? At delivery, the uncut placenta is wrapped into a towel and placed into a bag called a lotus birth bag, which is made of a waterproof bag and a cloth bag. To prevent infections and offensive odors from the decomposing placenta, during lotus birth, the placenta is washed twice a day in water, then a blend of herbs such as lavender and salt, usually Epsom salt, are massaged into it. And medically speaking, this is not really enough to prevent infections and add a possible complication as mentioned previously. In the lotus birth practice, the placenta is expected to dry and detach naturally from the umbilicus 3 to 10 days after passing through a desirable decomposition phase. And one of the biggest challenges is the follow-up, which if done in the hospital will lead to unnecessary hospital stay or frequent and therefore costly hospital visits before the placenta naturally and safely detach. The last not the least challenges for the healthcare provider is to comply to the respect of patients' opinions as one of the World Health Organization recommendations, which applies also during maternity care, including when parents are requesting a lotus birth. And there remains one big question: is lotus birth really necessary? Is it really worth it? However, despite all risks and challenges mentioned, some uneventful stories about lotus birth have been reported. We strongly believe that more researches need to be conducted on the topic so that clear and more detailed protocol get formulated about the lotus birth practice in the future. But as for now, the World Health Organization, the Royal College of Obstetrics and Gynecology, do not support lotus birth practice, recommending instead 1 to 3 minutes delayed cord clamping. I am Dr. Eric. This channel delivers information that supports health and holistic wellness. All the content on this channel is intended for comprehensive informational and educational purposes, and if not done yet, subscribe to our channel now and activate notifications so that you don't miss any content. Ladies and gentlemen, we thank you all for watching this video on lotus birth and for your continued support, and we hope to see you soon in our next video soon. Bye bye.
Stay up, don't let them see you, bitch. Always have a plan to stay tough. This life ahead of you ain't easy, it was built to be rough, but that's what makes